Hello, shade lovers. Welcome to the continuation of medication management in chronic, kidney failure. So the next thing that we've got to do is with regards to what we know as mineral and bone disorders. In this one, what is happening is you've got high levels of phosphate within the system and there's low levels of calcium. Ideally, the kidney would have, if the kidney is functioning normal, these two would have been in normal range, coupled with the kidney converting inactive forms of vitamin D, which is cholecalciferol, to its active form, which is cholecalciferol. So at this point, the aim is to reduce the levels of the phosphate that is accumulated in the system, because when the phosphate is high and the calcium is low, it leads to two things. It results in the bone thinning and increases the risk of bone fractures. So first thing that will be considered will be giving phosphate binders. So with these phosphate binders, they bind to the excess or the high levels of phosphates within the system to bring them down. Example could be the sevlima. Example could be the calcium carbonate or calcium acetate to bring the phosphate levels down. Next thing that would be considered would also be that there could be the giving vitamin D analogues, but with this kind of vitamin D, it wouldn't be the cholecalciferol, which is the inactive form, but it's going to be the cholecalcitriol, which is the active form, so that the kidneys wouldn't be under the stress to cause the conversion. And when this is given, it helps maintain or brings in restoring the levels of calcium and also suppressing what we call the parathyroid. But I'm not going to go into the parathyroid stuff. I just want us to understand these things. And the last but not the least on these mineral and bone disorders, where it's got to do with the fact that we would have to cut down on high phosphate diet. With regards to the high phosphate diet, it's got to do with having cola drinks is high in phosphate, processed meat is high in phosphate, dairy products, that's dairy overload with regards to our milk and all that, is high in phosphate. So we would have to cut down on these when the kidneys are failing to help with the management and slowing the progression. Thank you, shade lovers.